Welcome everyone to, we're broadcasting the webinar today from Kobe, Japan. So here we are with all of the editors and all of you, and we're delighted to be hosting this webinar at the launch of the book called The Care Dividend, The Case for Investment in Long-Term Care. The book is a tripartite collaboration between the Euro Observatory for Health Policy and Systems, the Euro region of WHO, and the WHO Kobe Center, the WHO Center for Health Development in Kobe, Japan. This book offers a multidisciplinary perspective on the impact of aging on economies, households, health systems, and society. Investing in a comprehensive array of LTC services can promote good health and functioning, while enabling individuals to remain independent for as long as possible. Such investments yield numerous benefits at the individual level, the family level, societal levels. And we also believe that investing in LTC can reduce the strain on healthcare systems and stimulate economic growth. So we look forward to hearing tonight a terrific group of speakers and our distinguished panel. And we hope for a very lively exchange to share learning on this very critical topic. So thank you very much for joining, and I'll turn it over to John Silas for the presentation.
So I'm going to share some of the key findings from the book, which is going to be available early next year. It is currently with the publisher. It's being published by Cambridge University Press. So I wanted to start off by motivating why this book. So as we all know, populations everywhere are aging. This figure on the left shows life expectancy in different regions of the world in 1950 and in 2020. And we can see that, of course, in North America and Europe, as well as Oceania, life expectancy is the longest, but there's been major catch-ups everywhere, including in the developing countries in Africa and Latin America, as well as in Asia. And these longer life expectancies combined with declines in fertility lead to an increase in the share of population at older ages. And we can see on the right, both historical data since 1950, as well as some projections through the end of the century, that the share of the population globally is expected to increase from around 10% currently. 10% of the population is over age 65, or a little less than that, to upwards of 20 or 25%. And of course, older people have varying degrees of care needs. I don't have a figure to show this here, but if we look at years lived without activity limitations, and we compare this to life expectancy, even within the European region, the variability ranges from in Sweden, where people spend 70% of their life over age 65 without activity limitations, without having care needs, to in Latvia, where it's only 30% of people's life over age 65 is spent without care needs. So one of the reasons we decided to do this book is because despite the aging population, despite care needs, long-term care spending is still quite low, especially relative to GDP, and if we were to compare it to health spending. So here we see in Japan, where we are right now, public spending on long-term care, at least the health component, it's about 2%. But much of the high-income countries, much of the OECD data suggests that the median is below 1% of GDP. And we see as well, I don't have the data here, but we see also, if we looked at the growth over time, even per 65-year-old, per person over age 65, we see that in many countries, spending per person is actually slowing despite the aging population. And just to give a sense of, in another way, of the lack of priority oftentimes given to long-term care. This is, again, OECD data on the out-of-pocket share of long-term care spending in orange, and in blue, this is the out-of-pocket share of health spending. And the purpose of this graph is really to show that long-term care in many countries is treated very differently than healthcare. So we look at countries at the top above this dotted line, including countries that have well-developed long-term care systems like France and Germany. Countries, the long-term care systems rely much more, the orange bar, on out-of-pocket spending to finance care than health spending. So in a country like France or Germany, the reliance on out-of-pocket spending is twice what it is in Germany. Again, if we look at Japan, where we are now, the relationship is reversed, although that's been more over the last 2 decades. But we see here that in both cases for health and for long-term care, there's a very low reliance on out-of-pocket spending. However, the long-term care component of this is much lower than health. So I think hopefully this very brief introduction motivates this idea of that long-term care is oftentimes ignored in policy circles. And to try and understand why this is the case, we did a book a couple years ago on the politics of aging, where we looked at why countries worry about aging, why they don't invest in life course policies. But in this book, we wanted to understand, one of our hypotheses was that one reason that countries don't invest in long-term care is because long-term care is seen as something that only affects a very small share of the population, the care recipients. And so we wanted to look at the evidence that long-term care influences not only the people receiving care, but that it influences health systems, it influences economies, it influences household finances, and it influences societal well-being. So a big part of the book, and what I'm going to focus on in the rest of my presentation, is the evidence base demonstrating, is there an evidence base that demonstrates that access to comprehensive long-term care, that it improves, that it benefits health systems, economies, households, and societies. So to focus first on health systems. So I think health systems is the most obvious or most intuitive example, where you would expect, of course, in many countries, including historically in Japan, where we are now, people who, there used to be in the 1970s and 1980s, medical care for people over age 70 was free, whereas long-term care required a lot of out-of-pocket payments. And so the result of not further developing long-term care was that people would end up using the health system when they really had more long-term care needs. And so you would think that there must be a strong evidence base that investing in long-term care benefits the health system. However, the evidence is quite weak, actually. There are cases studies where you see that more supply of long-term care workers, for example, reduces admissions in hospitals, reduces the length of hospital stays. But in general, the story is quite mixed, and there's a number of reasons for this. First off, the fact that it's very hard to do an evaluation of long-term care because the people that have the most long-term care needs also have the most health needs. And so we don't have good counterfactuals to draw on. And oftentimes studies are done with a very short window. And so we don't actually see the impact of some of these investments in long-term care. That being said, obviously, long-term care and healthcare are two very related sectors, and there are examples, which we talk about in the book, where efforts to really integrate health and long-term care have, for example, that we talk about in the book about an example in Canada where needs assessments were done jointly, where there was case management. And there we saw because the study was done over a 4-year period, so long enough to see an effect, long enough to build institutional capacity, we could see that investments in long-term care, that they did lead to fewer emergency admissions and lower hospital costs. And in general, the studies that are done better in this area, they look more at supply side effects. They see, having more care workers, having more residential facility beds, that these are correlated with less pressures on health systems. So I think the evidence base is there, but it's very challenging to do this type of work. In terms of how the economy benefits from long-term care, it helps to think back to what drives economic growth. And economic growth mostly depends on labor, capital, and productivity or technological change. And so a skeptic would say, okay, long-term care, investing in long-term care is bad for the economy because it requires additional taxes on labor, and this raises the cost of labor. And so this is going to dissuade employers from hiring new workers, and it's going to overall be bad for economic growth. The problem with this line of reasoning is that, of course, it ignores the fact that there are lots of people that are providing informal care and choosing or being forced to not fully participate in the labor market, or where they can't be as productive because they are doing both caregiving and trying to work in paid work as well. So this figure here, this comes from a mix of European countries where we see at different age groups, people's participation. In light blue at the bottom, this is in paid work. But in orange and the colors above, these are varying degrees of engagement in informal caregiving. And as we go higher up in the color scheme here, people are more and more likely to be less and less attached to the labor market. And so obviously there's already by not investing in long-term care, there's already adverse labor market effects. And these effects are primarily experienced by women. There's studies that show that aging, not only because of retirements, but also because of informal unpaid caregiving, reduces the quantity of labor. It should say quantity, not quantify. In the chapter, there's a range of studies are looked at that show things like about a third of women provide informal care before reaching age 65, that it reduces the probability of working by 6 to 26%. And increases the probability of retirement. Caregivers work fewer hours, they have lower wages. And obviously the implications in the long term, if people are, especially women, are not working, then they have lower pensions, or they may not have pensions at all. So a key message here is that by developing long-term care systems need to be designed in a way that promotes employment, especially for women, since they do most of the caregiving. Well, I don't have time to go into it in depth. In the book, the author of this chapter looks into parental leave and childcare policies, which are very similar to long-term care in that they largely affect female labor market participation. And there's some important insights that come from looking at those policies, mostly related to the need to support and adequately pay a long-term care workforce. In terms of households benefiting from stronger long-term care systems, as I showed earlier, there's a large out-of-pocket spending component to long-term care. These vary whether they are based on income, where people who are very poor maybe don't have to pay out of pocket or pay much less, at least for publicly provided long-term care services. They could be asset-based, or they could be paid by family members. And what I think is really interesting is that even in countries where that use income-based out-of-pocket spending, while you see that richer households are spending a higher amount per person on caregiving if they are using care services, the share of their income, if they're rich, the share is much lower than if they're poor. So income-based out-of-pocket spending or income-based out-of-pocket spending requirements, although in theory, you would think that they would provide some protection because they require less spending from poor households compared to wealthier households. In reality, the very high eligibility criteria mean that oftentimes the poor are still really adversely affected by out-of-pocket payments for long-term care. Just to illustrate what this looks like and kind of the role that the design of long-term care can play in alleviating poverty, this is data from SHARE, which is shown in the chapter. On the left, this is the percentage of caregivers who become impoverished by caregiving. So these are households who are newly poor. Maybe they had to give up work to look after a family member, or maybe they had new costs related to, they were providing some informal care, but there was also some formal care component. And we can see in all countries, there are households that are newly impoverished. However, if we look to the right, this figure here is the same set of households. In blue, this is the poverty rate before caregiving. So the same household before they began to give, the same set of households before they began caregiving. And in orange, it's the poverty rate after caregiving. And you may notice that in some of these countries, the orange, the after caregiving, is lower than before caregiving. So how can it be that there are all these households on the left which are impoverished by caregiving, but the poverty rate declines? And the reason is because in many of these countries, in countries like Spain or Austria, there's an important cash for care benefits component that effectively there can be very poor households that begin to offer informal care to family members. And as a result of receiving these cash transfers, this actually lifts them out of poverty. So before providing care, because of cash subsidies, because of cash subsidies, they actually are lifted out of poverty. And so I think it's an important slide to sort of demonstrate how different households can be affected differently by the need to provide informal care and the importance of mechanisms like cash for care benefits. The final chapter looks at societies and how societal well-being benefits from long-term care. Here, and I won't talk much because I think I'm running out of time. The author in this chapter looks at 3 pillars of societal well-being: social justice, social solidarity, and social innovation, and talks about how strengthening long-term care can benefit each of these. So for example, when it comes to social justice, the concept of social justice is concerned about the cycle of poverty, the generational inequalities. And of course, if you're a very poor household and you're unable to work because you're providing care to a very poor family member, the cycle of poverty sort of perpetuates. And so by strengthening long-term care, there's the potential to sort of to break the cycle and lift families out of poverty. Social solidarity really focuses on the whole relationship between carers and carees, which is the foundation. This lack of a non-hierarchical relationships is really the foundation of the welfare state. And finally, looking at social innovation, there's a number of examples where innovative ideas were developed to address issues related to long-term care. So one example, which I mentioned here in the slide, is a time bank experiment, where people exchange their time providing one service, maybe caregiving, for a different service provided by somebody else. So maybe they help to teach them how to do some sort of new skill. So last slide. So I think the takeaways from the book is that long-term care investing in long-term care has great potential to benefit health systems, economies, household finances, and societies. But just having a long-term care system is not a guarantee of success. And so while we talk, and we're going to hear much more in the following panel discussion, in the book, we try and identify some of the key criteria for long-term care systems. And just to name a few, I think these are long-term care needs to be publicly funded. It needs to cover everyone that has care needs. It should be supportive for both care recipients and carers. I think that's very clear, especially looking at the impact on labor market participation for carers. And it should be designed with clear objectives. And how countries can actually do this by designing their long-term care systems is something that we're going to hear about in the expert panel, which follows this. So with that, thank you for your attention, and I pass over to George in the other room. Yeah.
Great, thank you so much, John. I think you've done an excellent job of highlighting why this book is so timely and giving us a whistle-stop tour of some of the key arguments in there that we hope will be of such practical use to policymakers and practitioners in advocating for stronger long-term care systems. So I'm delighted to be moderating this panel with a very esteemed group of panelists. So we have Professor Yuichi Imanaka from the Graduate School of Medicine and the School of Public Health of Kyoto University. Welcome, Professor. We also have Dr. Ludovico Carino from the University of Trieste and Dr. Stefania Ilinka from the World Health Organization Regional Office for Europe. So I'm going to ask a few questions to each of our panelists, and then once we've been through those questions, we'll certainly have time at the end to take the questions that have been contributed by our audience. And Professor Imanaka, if I may begin with you, we know that financial sustainability in long-term care is a major challenge in many countries, and particularly those with a large number of older people and an aging population, as we know Japan has. So how has Japan approached this challenge, and has it been able to do so without jeopardizing access to services?
To maintain sustainability and access to care, we need to promoting strategic purchasing and research and development for evidence-based long-term care. And also we have to promote the social changes for symbiotic society. Okay, in our payment system for long-term care, we have several mechanisms to promote strategic purchasing. The fund allocations are linked to provider performance and health needs. First, to meet the client needs, we have detailed database and computerized algorithm-based certification system to grasp long-term care needs and to certify care need level. And payment is, we have some part which reflects pay for performance, such as outcome-based payment using indicators for care need level improvement, return to home rate, and social participation. These are some examples. And to promote evidence-based long-term care and developing higher technology, the government is developing databases, including very detailed data, which includes demographic information, activity of daily living, nutritional status, oral functions, cognitive impairment status, and the mental physical conditions of the client. And these are added to claims data and needs certification database. They are a national, very big database. And to input the detailed data is burdensome, and there is also some incentive to help data input. And some pay for data mechanism is implemented here. But the diffusion of the system is still a work in progress. But on the other hand, it is very much expected for this life database to contribute to the innovative development of services and systems. To promote symbiotic societies are very important for our society. And the government policy also reflects the promotion of symbiotic society, particularly in the area of dementia care. And for this aim, in our university, we created an interdisciplinary unit to design super aging society in the coming ages. And as an output by Ministry of Health, Labor and Welfare research grant, we made some kind of symbiotic society guidebook for the frail, including dementia, and for all the generations, and we showed visionary images with real example activities. This is a joint work of multidisciplinary collaborations. And we need to collaborate with outside of academia, and we created industry, government, academia, students consortium, which is called Pegasus, and we constructed social design framework for healthy symbiotic societies. And this is a framework, and we are trying to measure all of these 12 aspects of each region. of each municipality and of each smaller regions, and to monitor and promote more symbiotic and resilient and healthy city using data. And this is a cartoon image of the framework. And we also made a policy proposals with collaboration with various big companies in Japan, as the proposal by COCN, Council on Competitiveness Nippon. And these components are covered SDGs also. Since, as you know, determinants of health is very wide, and so we need to approach health using a comprehensive framework. And as I said, I propose 3 important points: to promote strategic purchasing and to promote strategic development of technology and services based upon data. And also, outside the long-term care insurance system, we need to promote symbiotic society. Thank you very much.
Professor, thank you very much indeed. That was incredibly insightful. And to those who are asking in the chat whether the presentation slides will be made available after this webinar, I don't think we do generally share the slides themselves, but of course the recording will be made available. So I think that what you've just presented is an incredibly useful resource to those that are seeking to understand how Japan has approached the challenges that it faces in providing for those in need of long-term care. I'm going to move on now to Ludovico, because one of the key points you made there, Professor, was around the need to ensure that services are delivered efficiently as well as effectively. And you also described how Japan has approached the determination of eligibility for formal long-term care services. And I think both of these are relevant to themes that Ludovico picks up on in his chapter of the book. So Ludovico, with population aging leading to increased spending, how is it that you think we can ensure that resources are used effectively and efficiently and that they're targeted where they're most needed? And of course, this must have a lot to do with determining who's eligible for care.
Thank you, George, and thank you, everyone. I think that I'll just give a few highlights of what is in this chapter. Some of these topics are also covered in the other parts of the book. But I would say that when you talk about effectiveness, efficiency, which are complex concepts in economics and in other disciplines, I think we can tackle this from multiple perspectives. But my chapter and my work so far for this book has been focusing on the role of eligibility rules. So we tend to overlook the fact that access to care is not automatic. It requires a gateway. You go through an assessment of need, and then people go through an assessment of need because the law requires it. And then there are eligibility rules, which determines whether the assessment of need has been successful or not, in a way. So I think that when we talk about effectiveness and efficiency, we must not forget the role of eligibility rules. And this is what we argue in our chapter. So the legislation should be written being informed by experts, by geriatricians, by gerontologists, by other disciplines that are relevant in determining what is need of care, let's say. Instead, what we see is that countries differ a lot in terms of what are the definitions of need of care. So the same individual, or two individuals with the same clinical profile can be covered in a very different way across a region or across a country, even countries that are very, very similar. Second point, I would say information is crucial. If we have limited amount of money, we want it to be effective. We need a strong information system. We need to avoid information gaps. Failed access to care caused by the fact that people don't know how to access the care and don't know how the eligibility rules work, and they don't know what they can expect to receive if they are eligible. So there is many times, there is lack of clarity on the package that is offered. What does it mean to receive a long-term care support from the government? I think this is something we need to work on. The system, there is a whole debate on how much transparent should these eligibility rules be. You can imagine eligibility rules that are more tailored, let's say, based, so they are more personalized and not very transparent. So each individual gets his own type of assessment, let's say. Or you can imagine a more transparent, but a little bit less flexible approach that instead is algorithm-based, as Professor Imanaka was saying. And then the last point I would say is that the long-term care system can be effective if it can also adapt and evolve, knowing what the other social policies are doing. So this would be my first answer to your point.
Okay, fantastic. Thank you very much, Ludovico. And I think that probably leads quite naturally onto a question I had for Stefania, which is around the question of the workforce. Because of course, if we intend gradually to expand eligibility, and I think that the arguments around the need to expand eligibility is something that really runs throughout this volume, then of course we need to be assured that we have a workforce that's actually able to provide for the needs that we're identifying and that we're targeting support at. So how big a problem, or how big a challenge rather, do you perceive the long-term care workforce to be in terms of the sheer availability of care professionals? And can you highlight some examples of what countries are doing to address these challenges?
Yeah, thank you, George, and good evening, everyone. You've touched on a sore point there. I think indeed the workforce challenges that we face are very significant, very widespread. There is reason for optimism. Just a few days ago in Astana, the regional committee unanimously adopted the framework for action on the health and care workforce for the European region. This is a momentous landmark decision, and it does point to the commitment of countries to address this challenge, but I think it equally points to the size, severity, and gravity of the challenge and the recognition that it's receiving. So maybe very, very broadly, I would highlight three important aspects: the fact that we face in both health and long-term care very severe shortages. The majority of European countries report shortages, and many of the service providers that participate in data collection on this topic have reported they have difficulties filling vacancies. This has been a long-standing issue in long-term care, but has become more acute in the aftermath of the pandemic. There's little reason for optimism that these shortages would improve in the future. If anything, there's significant concern about an aging workforce. And if you look at the Time to Act report, which I encourage everyone to look up, it shows that a very high percentage of the health workforce, and in some countries as high as 50%, is aged 55 and over, which means in the next 10 years, they will step out of the labor market, leaving a very important gap, and efforts to train an additional workforce that can replace them are really not matching up to the growing need. This to say nothing of the growing need for care. So at a time when we should invest in expanding the workforce, or should be looking at expanding the workforce, we are facing the issue of a contracted workforce. Now, in long-term care specifically, we see very high turnover. This is linked to poor working conditions, to limited pathways for career development. It's linked to low remuneration. This has been extensively recognized, especially at European level, but I think globally. And there are consistent efforts to improve this across many, many countries, as there are efforts to reduce the number of irregular and unstable contracts in long-term care. The last issue I think I want to bring into the discussion is the issue of, or the challenge of professionalization. There is insufficient investment in the training and upskilling of the care workforce, and this is a huge barrier for ensuring quality of care. We see that many key competencies which are essential for providing good quality care, for integration, for effectiveness, are either not taught or not taught to a level that is sufficient for the type of care we envision. And this, of course, limits the efficiency and the effectiveness of the care provided. What countries are doing, I think I touched upon. I think what is important that countries do is to keep in mind that there's a pronounced gender dimension to the workforce. So as much as 80% of the health and care workforce is represented by women. In some countries, that share is as high as 90%. So as we consider and address, design the policies to address these challenges, I cannot emphasize enough how important it is to focus on gender sensitive and gender transformative approaches to policymaking.
Excellent. Thank you very much. So I'd like now to ask another question of Professor Yamanaka. Stefania, you mentioned the need to introduce new and innovative approaches to delivering long-term care. Professor, can you highlight any specific examples of innovation in long-term care delivery in Japan that you believe offer a particularly instructive example for other countries? And then I'll come back to Ludovico and then to Stefania again. Thank you.
For example, in the institution, a long-term care institution, there is some new system to monitor client movement, securing their privacy. And with that monitoring system, which includes the technology of IoT, the caregivers in the institution can effectively and quickly respond to the needs of the clients. And some technology are introduced. And on the other hand, there are some trials in progress to use the exercise game for institutionalized elderly and to promote their activity and also their participation. And this really works. They can enjoy the participation and their mental health and their also physical function is expected to improve. And there are subjective good evaluation already, and now we are trying to measure more objectively. And so, and there are also some robotics to help caregivers to move the clients. And sometimes they have often lumbago, but it is prevented by using some kinds of robotics. And on the other hand, some robotics are very effective to promote rehabilitation of their physical function. And so these are some examples of using technology in long-term care.
Fantastic. Thank you very much, Professor. And those that are interested will find examples of specific innovations in long-term care practice in the forthcoming volume. But it seems that there's a few better places to look for such examples than Japan. So thank you for sharing those with us. If I could turn back to Ludovico for another question. Professor Yamanaka has highlighted the potential benefits of a symbiotic society that encompasses a broad range of benefits. Now, if we take a similar lens when we consider eligibility for long-term care, if we consider a broader perspective on the benefits of long-term care, what impact would this have on how we approach questions of eligibility?
Yeah, that's a great question. I think I really like the comments that have been made. Thanks, Georgia. We are on the risk of course, expanding too much, perhaps the definition of long-term care. But I think that you ask the right question. First of all, even within the realm of long-term care, when you define the eligibility rules, you have two strategies, let's say, which I could very broadly and quickly define as a preventive strategy rather than an intensive strategy of defining eligibility rules. The preventive eligibility rules are those that perhaps provide a little bit less support, but to a broader population, because they include, as people in need of care, those who have limitations, for example, in instrumental activities of daily living, which are the first stages of loss of autonomy. Whereas intensive approaches would recommend that you intervene in a heavier way, but after the loss of autonomy has already manifested. So that's already a big decision. That if you ask me to broaden this, I would say, for example, take into account the family situation of the individual. Think about all the social policies that are pushing older adults to work longer. No, that of course we show in many empirical research is taking away time for older workers that are a crucial pillar source of support for their parents and for the partners, for vulnerable adults. So these older workers are working longer, they have less time to provide care. Now, should the long-term care policies, let's say, incorporate this, internalize this issue? If you would do that, if you would say yes, and there are grounds to say yes, then you should design the eligibility rules to take into account also this. For example, the nature of work that the caregiver, the informal caregiver is doing. Now, if a caregiver has an inflexible, heavy, straining job, the informal caregiver, I mean, perhaps the government could help more the older person in need of care, no? Just to say. So I think that this is an important point. So let me leave it at that for now.
So thank you. And Stephanie, if I may come back to you just for a brief question. So if promoting community-based care is going to be a key part of the solution, then looking beyond eligibility rules, could you highlight a couple of strategies that countries might use to promote it? Any particular examples that you think have been particularly effective?
Thank you, George. Maybe let me define what we understand by community-based care, and this would include care in the individual's home, as well as care in daycare centers or any community-based facilities that do not include residential services. So I think if we're all on the same page with that, that is indeed the direction that is recommended for long-term care development, both on grounds of cost effectiveness, but more importantly on the ground that it seems to reflect better the experience, the expectations and the preferences of care users. What can we do to increase access to community-based care? I think a very important aspect, maybe building on the point Ludovico was making about coordination with other policy areas, is a stronger focus on integration, on integrated service delivery, and looking at how community-based care services are coordinated with other health resources, but other social welfare and informal support resources in the community. Which brings me to a really important point that in a community-based settings, there is an increased need for improving coordination between formal and informal care providers, so that care services provided by trained professionals are well matched to their respective skills, whereas informal caregivers contribute into the care process in a way that reflects their own abilities, skills, and preferences. So this would also be a very important way to ensure that investment in community-based care is not a way to contain costs while passing additional pressure on informal caregivers to pick up the slack. So that's very much not what this policy direction means, but rather building stronger, better, more effective partnership and coordination between different types of care resources. If I get one more minute. I guess it's also important to say that investment in community-based care is investment in the communities themselves. So it's very much linked to investment in enabling environments, because the need for long-term care is defined in the interaction of the individual with his own intrinsic capacity and the environment in which he or she functions. So investment in adapted housing environments in the private sphere or accessible environments in the public sphere are, I think, with the risk of mission creep, important policies for long-term care, although they might seem to fall rather in the sphere of urban design. Similarly, you can think of investment in transportation and accessible transportation as an essential vehicle for promoting social participation of older people, which is a relevant long-term care outcome, but it can be achieved only through coordinated actions across these policy areas. Housing is another important one, but I won't go into the details. I think the last point I'd like to make is that we see innovation where there is space for locally driven design, adaptation of ideas so that they are best matched to the capacities, the competencies, and the specificities of each community. This, of course, happens where there's a supportive national framework, both in terms of flexibility of regulation and legislation, but also in terms of availability of financial support, risk pooling, and a focus on equity. But by and large, I think it's important to invest in the communities themselves and to ensure that at the local level, we have both the power and the resources to see full engagement in the design of such initiatives. Thank you.
Fantastic. Thank you very much. What an excellent panel we have. And I think that Stefania's last answer almost brings us full circle, because it feels what you just said feels very consistent with the notion of a symbiotic society, which is lovely. So what I'd now like to do is to open it up to our audience. I know that Erica is on the line and has been sifting through what I'm sure is a huge number of questions. So Erica, would you like to share some of those with us?
Yes, very, very lively chat box. Thank you to everyone for their engagement. Some really good examples coming in from other countries, particularly around Europe. And if people have some insights into the global experience on time banks, that's something that sort of was mentioned. But a lot of the other things are around, how can we better integrate long-term care with the wider health system? And are there any good technological tools that we can use to facilitate this? Also, how do we assure the quality of long-term care for people and the challenges around that? Let's leave it at that for now, but I have plenty more if there's time.
Okay, great. Well, Stefania, I think I had a question in reserve for you on the role of technology. So can I come to you for that first question on the use of time banks?
On the use of time banks?
Yes.
More specifically?
Erica, would you care to repeat the question on time banks, please?
Yes, it was. Well, it was more of a comments than a question. Someone mentioned that time banks were something that were being used in some European countries, but in a different context. Right. So how would this, how could this policy be rolled out? If you don't have information on it, that's fine. Don't answer the question. So
no, it also wouldn't be the first example, I would think, in the context of the potential of digital technologies for long-term care, for sustainability specifically. I guess we should probably clarify if we're talking about technologies and digital innovation that facilitates more effective long-term care processes. And I think there's a strong strand of evidence that's being built about what is useful, what helps care workers in their activities, how data and evidence can be more efficiently collected, interpreted, and used to inform long-term care processes and practices. So that would be one strand that I am very optimistic about, and I think we have every reason to be optimistic that it will contribute to cost containment, although there is always the risk, of course, that high reliance on technology comes with additional costs. This has been the case in healthcare. But I think it's really important to also talk about assistive technologies as an important contributor to long-term care, because better access to assistive technologies could really reduce the need for long-term care services. And this is a highly cost-effective intervention. Many of these assistive technologies are actually quite innovative, technology-based, and they range very far to compensate for sensory limitations, for cognitive limitations, mobility limitations. I think there are wonderful technologies that allow for social participation and connectivity in ways that we haven't seen before. And as the evidence is growing, I think there's great reason for optimism that if there is adequate investment with a very clear focus on equity, because we run the risk of this becoming yet another barrier and yet another gap in access, there's wonderful potential.
Great, thank you very much. And the second point, I think the question on quality, I might address to Professor Imanaka, because I'm sure that you're replete with good examples from Japan of how it is that you assure the quality of the services that are provided. Professor, would you be able to offer some insights on that? And I must actually add a plug here for the book, because there's an excellent chapter on managing quality of long-term care and various strategies that can be deployed. But Professor, please.
Yes, there are several aspects in quality of long-term care. Well, usually, under long-term care, the care need level is going down. But in some facilities, they do very effective rehabilitation services for the client, and they regain their physical function. And these services are under the long-term care, public long-term care system. And they also provide outside of the public system. They have clients have to pay additional money, and they show the very high effectiveness in rehabilitation services. And one indicator regarding quality of long-term care is to sustain their functions, physical, mental, and cognitive functions. And sometimes they can improve under good effective rehabilitation. And the other important point is social interaction for their for the client functions. And under the public long-term care insurance system, some trends just started to promote social participation of the clients, and it will be diffused, I hope. And the other one is some return to home rate from the institution in the case of institutionalized elderly. And if they want and their family is ready, this can be a good indicator too. But when we think about care at home, sometimes informal care burden is very big to the family and informal caregiver. And so we have to think about the rate carefully. But usually, return to home rate is very important too. And these are some examples. Thank you very much.
Thank you very much, Professor. Erica, do we have time for one more question?
Okay, one question would be, how can we effectively make the case to policymakers that this is an issue that needs to be addressed now rather than sort of right down the line? So what would, from the panelists, what one thing would you do to convince
Make the case.
this is what we need to do now?
And that's for overall emphasis and investment in strong long-term care systems, I would imagine.
Yeah.
Ludovico, Stefania, would you like to take that?
I'm going to be saying that I think the investment in long-term care is valuable because, as John Silos has shown and many of our chapters discuss, there are several externalities. It's not something that you do for the population, which would be already valuable, but the investment in long-term care goes beyond the population that it immediately addresses. If you help providing care, or as Stefania was saying, you promote, I don't know, a better environment for people, you generate, let's say, the conditions through which people can stay longer in their own dwellings, they can postpone the onset of frailty. You're not just helping them, you're helping their families, you're helping their partners, you're helping potentially their grandchildren. You're creating a society which is healthier. And ultimately, this will contribute to economic growth, which is one of the final targets of all these policies. We hopefully want to continue. Let me be clear, not economic growth, well-being growth. Okay, so that's the ultimate goal. No, we want to maintain a long run and increase in our welfare, in our well-being. No, and this is only and the fact that you can improve the health conditions of people is a crucial, and their families is a crucial determinant of that.
Thank you very much, Ludovico. And indeed, that's really what this book is all about. That's what motivates this book, and that's what's motivated this session today. So I think that very regrettably, we're pretty much out of time. So if I might ask that the final slide be brought up. So this is the forthcoming book. It'll be available early in the new year, and it provides a really broad-based coverage of many of the issues that have been picked up today. And of course, John provided an excellent outline in his presentation. So there's a link there, and you can access it and register to be notified when the book is available. We thank you very much for your interest in it, and we do hope that it'll be useful in informing, again, policy and action on this absolutely crucial agenda. So it just remains for me to say an enormous thank you to our speakers, to our panelists, and of course to the World Health Organization Kobe Center for hosting us for this event and for helping us to promote this important publication. And finally, of course, thank you very much to our audience for your interest. And yes, we look forward to engaging with you all in future as we seek to promote this book and the arguments it makes. Thank you very much.
Thank you, George, for moderating it, by the way.
Thank you.